This is Donald Leung, Editor-in-Chief of the JACI. With me today is Dr. Lynda Schneider, who is Associate Professor of Pediatrics at Harvard Medical School. The theme of February's issue of JACI is atopic dermatitis. Dr. Schneider, what prompted you to redo the previous practice parameters?
Well, the last practice parameters were done in 2004, and since then there's been a tremendous increase in our knowledge about atopic dermatitis. One of the key findings over the last several years has been an emphasis on the importance of atopic dermatitis as a skin barrier defect. In the new practice parameters, we highlight in a very good section on immunopathology and genetics some of this new information. We cover information on the role of reduction and mutation of filaggrin and other stratum corneum barrier proteins. We also review the importance of the tight junction proteins and some recent work that shows a reduction as well as mutations in claudin-1, which is a tight junction protein which is at the base of the stratum corneum and is also important in protecting the skin barrier. In addition, there's been a lot of new information on the fact that atopic dermatitis patients have reduced innate immunity. So the practice parameter section includes the information on the reduction or lack of function of TLR2, and also some very elegant work done largely in your lab on the reduction in the antimicrobial peptides on the surface of the skin of patients with atopic dermatitis.
What clinical implications do these observations have for the practicing physician?
Well, the main clinical implications are that you really need to educate the patients about this lack of barrier function, and you really need to treat the barrier. We include in the treatment section this information on making sure to do moisturization. We also have new summary statements on treatment consideration of vitamin D or bleach baths. We also have a new summary statement on sleep disturbance because there is new data that suggests that this is an important factor in mental health comorbidities. And then we also have updated the section on infection, and in particular we take a slightly different approach because of the emergence of MRSA. And then finally, there's a really terrific section on the difficult to manage patient with atopic dermatitis that includes a section on wet dressings as well as updates on phototherapy and also on other immunosuppressives.
Well, thank you, Dr. Schneider. For the viewer, please not only go to see Dr. Schneider's paper on updated practice parameters, but there are some exciting reviews by Alan Irvine on multifunctional row of filaggrin, as well as Lisa Beck's group on the row of the innate immune response in atopic dermatitis, and other original articles and work involving the pathophysiology of atopic dermatitis. Thank you for your attention.
Thank you.